Hello doctors, I'm your med buddy Arun, and today I'm presenting you a video on syringes and needles. Today let's talk about these syringes and needles which are present in different shape, size, volume and different packaging as well. I'm gonna tell you how to identify a syringe and a needle that can fulfill our purpose of infusion and sample collection in best way. Here we have syringes of different volume, different shape, size and different packaging. So let's start from a 1 ml syringe. So it is a 1 ml syringe and up to 1 ml infusion can be done from this syringe, and the purpose of this syringe is mainly the intradermal infusion. It is used for insulin infusion subcutaneously and also intradermally for the intradermal placement of penicillin for checking the hypersensitivity towards penicillin. So let's talk about what are the parts of a normal syringe. So here we can see it is the thumb rest. This part is called the thumb rest, where we rest our thumb, of course. Here is the finger hedge for it between two fingers. Now this part is called the barrel. These markings are called the dosage marking of a syringe, and this part is called the leer lock. At this point we lock the needle, that's why it is called the leer lock. Here is a syringe of 3 ml, which is a standard syringe with a standard needle of 21 gauge. How do I know that it is 21 gauge? So here in this needle it is mentioned that it is 21 gauge. The diameter is 0.8 mm and the length is 25 mm. So it is a standard needle for the purpose of intramuscular infusion, and subcutaneous infusion can also be given in absence of small needles, and IV infusion as well. So based on our requirement we choose what needle and what syringe do we need. Now let's see what are these needles and what are the purpose of different needle. How do we identify them? So here is the needle of 25 gauge. The gauge and the thickness of the needle are inversely proportional. So the larger the gauge number, the smaller will be the needle, and also the smaller will be the diameter. So you can see and you can compare that this needle is really very thin in comparison to this 18 gauge needle. Also one thing is to be remembered that these colors on these needles are not the random colors. They are the universally accepted color coding of the needle. So if a 18 gauge needle is there, it will be having a pink color of its cap everywhere where this color coding is accepted. Yes, countries can have their own codes as well, but this is the universally accepted code color. Here is the another needle. It is a 30 gauge needle. From the size itself you can see that it is going to be really very small, because the larger the gauge number, the smaller is the needle. And this is how we see it is again the needle with a safety attached to it. It is a very small needle, you can see, and it is used mainly in the intradermal infusion. You can see it is a very small needle, 30 gauge needle with a safety attached to it. It is a 18 gauge needle. Let's see how does it look from inside. So it is a 18 gauge needle with a safety attached to it. So once it is removed, the safety is on. So you can see it is quite thick, not quite thick, it is really thicker than other needles. So it is a 18 gauge needle, and after using it we never put the cap back. It can harm you. It can put the infection inside your body. So this is the safety on. We place the safety after using it. This is how it is used, and it is non-reversible, so it cannot be reversed. When it is done, it cannot be reversed, for the safety of the physician. And here is another needle that is of 22 gauge. So 22 gauge is a standard needle which is mostly used in most of the settings. It can be used in IV, can be used in IM, and also the subcutaneous purpose as well. So it is a standard needle. Now lastly, there are very especially manufactured, prepared set of needles and syringes. As you can see here, it is an arterial blood sampling kit. It is not a normal syringe. It does not carry a normal syringe. It has a syringe which is coated with heparin, lithium heparin from inside, so that the blood do not coagulate once the arterial blood is in it. You can see here it is written it contains heparin, and it is not for injection also, it is mentioned here, which means that we have to collect this sample from this needle. It is for the purpose of collection only. Also, it carries a needle which is a 23 gauge needle. Here it is mentioned the 23 gauge needle, and also the color coding of this gauge is the orange. So this is all the basics about the needle and the syringes. After needle and syringes, we also have a small apparatus which is called the connector. When there is requirement of a longer syringe and we do not have one, then these connectors can be useful. These connectors do have one side valve, and we simply connect it to the lure lock like this. We remove the cap and we insert the syringe, and we simply insert the syringe like this. It is helpful for increasing the length of the syringe when we want to use the syringe for deeper purpose, like if we want to do infusion within oral cavity near the pharynx maybe, then these kind of connectors are useful. So now lastly, let us see what are the basic parts of a needle. So here you can see it is the shaft of the needle. The hole of the needle is called, of course, the lumen, and it is the bevel of the needle. The sharp point is called the bevel of the needle, and it is the edge of needle. So this is all about the basic of needles and syringes.